This is the Adventist Medical Center Inpatient Audit Team. My name is Yana Medvedev.
My name is Michelle Nguyen.
I'm Jeanette Esker.
And I'm Brittany Hassan.
And I'm Alex Patera. And Jessica Cardell, she's on the upper floor.
Jimmy, you're on the east side of Portland at Adventist Medical Center in Multnomah County. It's okay, although our hospital is not trauma certified, we offer other treatments as well. We offer radiation therapy, cardiovascular care, labor and delivery care, outpatient and inpatient care, as well as emergency services. We treat 12,000 patients annually, and there's 1,000 deliveries and 55,000 emergency room visits. Jimmy, we're going to transfer you to the ICU, okay? Hang tight.
Hi Jimmy, I'm your nurse. I'm just going to do some wound dressing changes here. The AMC is a faith-based hospital, and our mission, vision, and philosophy statement reflects that. Our mission statement is living God's love by inspiring health, wholeness, and hope. It's posted in many different locations throughout the hospital, along the street, entrance of the hospital, on the banner in the hallways, and near the elevator. Our vision statement is transforming the health experience of our communities by improving health, enhancing interactions, and making care more accessible. It's not posted in the hospital anywhere really, but you can find it on the website. Our employee handbook, it mentions our open door policy, which states that Adventist Health's goal is to provide excellent healthcare services in keeping with the Church's philosophy and teachings. We value each person regardless of religious beliefs or affiliation. We believe that the value of inclusion and accessibility is important. The nursing staff and their huddles with prayer, and if you need it, many are more than happy to pray for you if you'd like. The nurse manager makes rounds and interacts with the patients on the floor, inquiring about their experiences at the hospital. Many of the patients that are admitted are homeless, which further lends to the fact that we strive to make our services acceptable, even to people that may not afford care. Through the actions of staff, AMC strives to establish a healing environment where serving others through words, actions, and attitudes is a key priority. You're in good hands.
Staffing design is essential to an organization's overall ability to function effectively and efficiently. At AMC, staff members are assigned to 12-hour shifts. The staffing office uses a grid to help organize departments based on volume. On the post-surgical, orthopedic, and neurological units, there are a total of 42 nurses and 13 CNAs. There is typically one nurse to every 5 patients per shift, unless a high acuity is present. If that is the case, the ratio then changes to 1 nurse for every 4 patients and 1 CNA for every 12 patients. There's a shared governance when it comes to making decisions regarding the needs for each unit. All staff members are able to make requests for equipment purchases. However, the approval for these requests depends on the budget available. A nurse manager at AMC states that budget and productivity are reviewed closely. She mentions that managers are able to explain why a unit may have a low budget and what steps have been taken to manage it. This teamwork between staff members is an important factor in achieving quality care without the results of a negative variance or a diminished budget.
Quality improvement is an important aspect of a nurse's career that can ultimately improve patient outcome and care. Famous quality improvement projects implemented by nurses originate back to the founder of nursing, Florence Nightingale, when she observed hand-washing practices and patient outcome. The process of quality improvement is continuous. There's always a goal to improve care and patient outcome. The process is important and needs to be supported by data and tailor-made to each organization. Based on several nurse interviews, it's obvious that the prevention of hospital-acquired infections is of great concern in the hospital setting. Such infections lead to increased patient morbidity and even mortality, and also greatly increased healthcare costs. Often the hospital itself must absorb this added financial burden, as insurance companies do not reimburse for hospital-acquired infections. Frequent invasive procedures such as the insertion of central lines increase patients' risk of developing a hospital-acquired infection. Central line placement and maintenance is an area of potential reduction of costly and dangerous hospital-acquired infection. Patient safety goals have been set forth to increase quality patient care and lower associated risks. The National Patient Safety Goal 07.04.01 speaks to the use of proven guidelines to lower the incidence rate of central line associated bloodstream infections. At AMC, the current measures aimed at reducing these infections involve proper hand hygiene and a 50-second scrub of the hub access point prior to access. The new best practice bundles that our group has created should involve the use of CHG dressings to cover central line insertion sites and daily CHG bathing for patients who have central lines in place. This should be in addition to the already adopted insertion and hygiene protocols.
Adventist Medical Center prioritizes patient care, continually working toward improving patient outcomes and satisfaction. One change that could improve patient care would be to decrease the patient to CNA ratio on various units. According to the AMC audit, the current ratio is 12 patients to each certified nursing assistant. With such a large quantity of patients, it is difficult for CNAs to provide effective, individualized care to each patient. Upon researching the healthcare organizational audit process and applying it to Adventist Medical Center, we discovered the strengths and weaknesses of the organization. Prior to the audit process, it was assumed that all hospitals in the area would provide the same level of patient care. But after looking into the organizational instructional aspects of AMC, some areas appear to be lacking. An example of this is that AMC is not equipped to handle trauma patients, and AMC is not ranked as a trauma center. Therefore, trauma patients who are admitted to the AMC emergency department are frequently transferred to OHSU, which is a level 1 trauma center, to receive treatment. Thankfully, OHSU and AMC have combined forces and worked together to provide the best treatment for trauma patients. The resources that OHSU provides to AMC have been beneficial to both organizations. We challenged the assumption that all hospitals provide equal level of care by investigating the structure of AMC, which provided information regarding the many strengths of the organization. The most notable strength of AMC, which makes the organization stand out from others, is that it is faith-based. People travel long distances to be admitted to AMC because faith-based care is provided. Being admitted to the hospital can be a terrifying experience for the patient and their family. Providing faith-based care can provide an additional sense of comfort to the patients, which can help improve patient outcomes and satisfaction. Realizing that each organization has its own set of strengths and weaknesses is an important factor to keep in mind to improve future professional practice. Organizations have individual ranks and accomplishments regarding different aspects of patient care, and it is important to recognize each organization's individual strengths and acknowledge that one facility is not superior to the other.
Hey guys, can I get you in here for a quick huddle? I want to talk about some teamwork. Okay, so our team utilized interdependence while working towards the common goal. The goal for this assignment was to work together effectively while completing an audit of AMC. Each of you were committed to the common goal, willing to cooperate, and open to conflict resolution when issues arose. What would you say was the hardest part of working as a team?
I would say essentially effective communication is probably the hardest.
Yeah, definitely. With all of our different personalities, we learned to work well with each other and communicate effectively and cohesively. When conflict did occur, the key to solving it was honesty and refraining from judgment. Being honest and admitting when we needed help was very effective because it allowed our team members to step up and help us. The workload was evenly divided up based on what we felt most comfortable doing. If we were struggling, we would ask our team members for assistance. Each team member played an active role and showcased their individual strengths throughout the project. Within the group, we had extroverts, introverts, and some who would classify themselves as both. We were sensitive to each other's needs and avoided power struggles within the group. We advocated for each other and made sure that everyone was heard. This helped our group meetings and discussions run smoothly. Thank you guys.
Solid.
And this concludes our presentation.
Merry
Merry Christmas!